To hear her daughter say that to me, that she knows that her mom's going to do well because she saw me survive this. Yeah, we have to fight for each other and encourage one
Mm.
another on through this because other people have to see that this is a very survivable disease. I guess my message is it's a hard pill to swallow when you get the initial diagnosis. Despite all the positive things that we've mentioned throughout the video, don't think that it's wrong of you if you have those dark moments because, those dark moments are very real.
Welcome to the Take 1.5 podcast. This is your host, Min Lee. In North America, October is Breast Cancer Awareness Month to increase the awareness of the disease, also to fund for research of prevention, testing, and treatment of this very harsh disease that affects many, many women in America and all throughout the world. So today, my guest is my friend, Crystal E. She joins us from Huntersville, North Carolina. So welcome, Crystal.
Thank you for having me. My name is Crystal. I am a physician. And I was first diagnosed in 23. So I'm 2 years out from my initial diagnosis now.
You look wonderful.
I feel good.
You're just incredible. I am in awe. I invited Crystal to just share about just basically personal experience. We hope that it'll be encouraging to others that, if you're going through, you'll know that you're not alone. You're not going through it alone.
And I think that's the biggest thing. I think the last statistic that I heard, it's 1 in 8 females who will get breast cancer at some point in their lifetime. I didn't think it would ever be me because I just don't have that family history. But when I first found my cancer, I was 38 years old when I was diagnosed. And without any family history, I thought that the mass I was feeling was just benign, was just something that I could brush off. I would get my mammogram and I could just move on with my day. But the imaging certainly came back concerning. And then the biopsy was obviously cancer. And I remember the moment when I got the phone call. I was getting ready to operate on someone else, and you hear that news and you just have to push it in the back of your mind and deal with it later on. And I just remember just being very dumbfounded that this is obviously a lie. It's not true. But slowly the diagnosis settled in. And I think the worst part with my diagnosis, and it's not, oh my God, I have cancer. Every news after that was just bad. It wasn't just you have cancer, it was you have no positive disease. It was you'll need chemo, you'll need radiation, you'll be in medically induced menopause. I just felt like my entire femininity being stripped away from me at that point. And so it was a very rough go to in the beginning, certainly.
Yeah. I remember when I got that call, I was 47, 48. I had 4 little kids. I was driving to work and like, what? What do you mean? Because
Yeah.
like you, I don't have any family history of breast cancer at all. So I never thought. Can you take us back to that day when you got the call? You're about to go to operate on someone else. And what did the doctor say?
So remarkably, my doctor also works with me. She's a very good friend. And
Mm.
she goes, Crystal, what are you about to, are you busy? And I tell her, listen, if you're calling me at this hour, it obviously is bad news. Just give it to me. I have cancer, don't I? And
Mm.
she confirmed. And then I just went about my day. And later that afternoon, I met with her. I am in a situation though where I have healthcare. And on top of that, I have very good insurance. And on top of that, I'm very well connected. And so everything was just very quick. I got to the imaging center literally the next day. I got biopsies the next day. I was seeing the oncologist the next day. I would hope that we all fight for our patients the same way, but certainly I think because of my position, everything was much more expedited too. And so everything just came on very, very fast for me, which in hindsight, I'm very thankful for because that's my personality. If I was allowed to just let this drag on, then that would have been much more difficult. But everything was just okay. Let's go. Let's go.
Yeah. Well, actually, as a patient, that was kind of my experience as well. With the oncology department, I think the medical staff really expedite everything and really care for
Yeah.
you. So, yeah, I was
Yeah.
very
Good.
thankful too. I found my lump just in the shower out of nowhere. But all of a sudden, one day, I remember I was very sick for a couple of weeks. And then I was feeling a little bit better. I was in the shower just to get ready to go to work. But then I felt actually like a golf ball size something, a mass, right? And I said, "Oh, I never felt this here before." So that reminded me, okay, I need to make an appointment to go get a mammogram. How about you?
Mhm.
Like, how did you find your lump?
It was just something I felt also. And because I was so young, I didn't think much of it. I probably had noted it for a couple months before that. And the difficulty with younger patients like me is that we have dense breasts, which
Mhm.
means it's just very firm and full versus older ladies who have a little bit more lax breasts.
And Asian too, right? Most Asians
Yeah,
do?
Asians in general also have very dense breasts too. My cancer didn't even show up on mammogram. I had to get an ultrasound separately to even see it. And then because of my age, it got escalated to an MRI that really showed the full expanse of how big it was.
And then what
Yeah.
stage were you at that point?
Because I was node positive, that was stage 3.
What does node positive mean?
I had lymph
Okay,
nodes with
yeah.
cancer in it already. Yeah.
Okay. You and I have very similar diagnosis and treatment path.
It was very good also, just on that note, that I was hormone receptor positive. With breast cancer, there's hormone receptor positive, ERPR positive, and then we also check for HER2. And then I think the benefit of being receptor positive is that there's directed treatment for it. So I am, if I had, can be thankful about one thing with my cancer is there's treatment for it.
Oh, gosh, you're so positive. That's great. As a cancer patient in the oncology department and meeting so many different doctors, and everyone's explaining to me what I have in their own special language.
Uh-huh.
What are you telling me? You
Mhm.
know, what would you say to like a regular folks like me? Like, what would be a good way to understand like what's going on?
Have someone with you so that there's another set of ears listening. And then don't be afraid to ask questions. Even if you feel like it's the most dumb question or circle back. What did you mean by this? I mean, what does it mean with this? Even with my medical background, there was a lot of questions that I had when I was meeting with the oncologist too. And so don't be intimidated by all the medical jargon. Fight for yourself, advocate for yourself, make sure you're getting the appropriate understanding of your own disease because never is it our intent for you to not understand, but we
Mm,
just don't know how the extent of your understanding unless you make it known to us what you do know and what you don't.
you mean the doctors, right? Well, what was your greatest hurdle? What were you feeling as a patient on the other side?
The entire thing was such a hurdle. Oh my God, I'm going to lose my hair. Oh my God, I'm going to be induced in menopause. When you're node positive, also, there's always the concern that they'll do a complete lymph node resection at
Mm,
the time of procedure. And that was a huge hurdle for me too, because
mm,
the biggest side effect of that is developing lymphedema. And I didn't want to risk that. I'm a surgeon. I operate and I needed full access to my arm. Unfortunately, I ended up developing it anyways, but it was just all these little side things that wasn't congruent with my lifestyle at that point. That was just very upsetting overall.
mm. And so you got the news. Were you the one who told your family? Knowing you, I could imagine going, Mom, I have cancer, so it is what it is. But like, what did you tell them? And how did they
I
take it?
mean, that's exactly how it went down.
Of course, it's
Mom, I
Bristol.
have cancer. I mean, because she knew I was getting the biopsy and she knew we were
Mm,
waiting for pathology. And then
I
I
see.
let her know, yeah, it's cancer. And remarkably, she took it very well. Didn't think that she would take it as well as she did. And maybe it's because she just knew that she had to be a fighter for me
Mm,
and she just had to repress it. I don't know. But I didn't just tell her, I told everyone I knew. And
mm,
the reason why I told everyone I knew is because in that moment, I knew I couldn't do this by myself. I needed to call and ask for prayer and ask for people to just think of me. I don't know if you know in Korean, there's this like phrase where you advertise your sickness or whatnot. In advertising my illness, I found so many resources. People saying,
mm,
"Oh yeah, oh my gosh, I have a friend that just went through this. Let me connect you with them." And so I got connected with a lot of other people who had already gone through the experience. And it's not so much for me to glean upon their experiences so that I have an anticipation, but it's just so I can feel for myself a reassurance that you can
mm.
survive this and that there's people who are still alive, I guess, after the fact.
Yeah,
Yeah, so I told everyone and everyone, and I told the entire church
yeah,
asking for prayers
yeah.
because I wasn't gonna do this alone.
That is such a good insight and such a wise thing to do. A lot of people want to hide it. I don't want to tell anybody. I don't want other people to feel sorry for me or whatever it is, especially for Asian culture. You don't tell those things.
I don't know if there's a vulnerability when you
Mm,
let other people know of your
mm,
illness, and
mm,
you had mentioned people feeling sorry for you and things like that. I wanted people to feel sorry for me. I wanted people to know that I had cancer, and if I was feeling ill that day and not being very happy to see you or not being very receptive in conversation, it's because I just didn't feel good. I have
mm,
cancer, so I just needed people to understand
mm.
um, me. So I don't know why people have this vulnerability with their illnesses. It's not wrong for other people to come and help you, certainly. Maybe we're just so attuned to having this strong, independent type of persona, but I think when you have cancer, that is not the time.
Felt out of control during the time I was going through cancer treatment. Maybe it's a little different for me because I had children that like completely were dependent on me. But yeah, I felt super out of control. Like there's nothing I could do to make this better.
Yeah. I think, and the point I want to make is not everyone's journey is going to be the same. Certainly,
Right.
your
Right.
journey as a young mother with very young children, a wife, versus me being very single and not having to care about anyone else. I think the journey is different, but in the end, I think the message that needs to be reached is call on everyone that you can because you can't do it alone.
I still feel so thankful for all those who reached out to me during that time because it means a lot. It means a lot.
Yeah.
So what was your journey like after your diagnosis? You had surgery first or chemo first?
Because my cancer was so far progressed, I had to go through chemo first in hopes to downstage my cancer or to make it smaller. So it was 16 or weeks of chemo, 12 of which I worked through. And then I took time off to do the last regimen and then had my surgery. And then it was like 13 weeks of radiation. So, I mean, that sounds a lot longer than it actually was, but it was radiation afterwards. And then I went for reconstruction the following 6 months after that. And then most recently, I had another procedure done just so I can help the swelling in my arm. But even though it seems like it's never ending, I mean, you just have to deal with it. During the course of chemo, I obviously lost my hair. And at first, it was devastating. It was so devastating to lose the hair. People can't imagine just brushing your hand through your hair like this and just everything falling out at once. It was just so upsetting, and I just get a little teary thinking about it, but after I lost all my hair, it was the greatest thing ever. It was summer, and I was high, and it was, like, the most freeing thing, and then, honestly, I walked out all the more without my hair because people were so much nicer to me too. I'm standing in line and people would move and they would say, "Why don't you go first?" Or I mean, honestly, people just clear the way or I'm shopping and people are asking me, "Oh, can I help you?" And, "Oh, yeah, please, if you don't mind." Certainly it drew a lot of sympathy, but that which started out very
Mm,
damning and very upsetting turned out to
mm.
just be perfectly fine.
I remember one incident when my hair was, of course, all fallen out, and I was wearing wigs. It looked horrible on me, but I didn't know what
Mhm.
else to do, right? My kids, my boys were young at the time, and they were
Yeah.
scared,
Yeah.
so I had to really like cover my head. But one time, I was in my bathroom minding my own business,
Uh-huh.
and there was a handy person at home, and he didn't know I was in my bathroom, and he walked into the master bathroom to check something. I walked out of the bathroom very quickly. I was just sobbing, and I don't know if I was necessarily embarrassed, but just sad that I was in that situation, just because the way he looked at me
Like,
was
he looked at you with pity or just in
I don't know,
shock
he
or
just shocked, probably, mostly. Probably
yeah.
it's more me of how I was viewing myself. Yeah, at that time, I guess I was unaware how much my appearance meant for me. I thought, "Oh, whatever," but no hair, and then I'm all, like, puffy, because of the chemo and steroids and
Uh-huh.
everything. just looking and feeling terrible. I think that really impacted me in a negative way, seeing myself that way.
And I think that's one of the reasons why it hits us a lot more too, because we take time to do our nails, to make sure our eyelashes are long. And it's not necessarily vanity, but it's just how we identify as females.
Mm.
But yeah, I get it. For me, I looked good bald too, so I
Yeah, you
went
did.
with it.
You really did. You really did. So cannot believe you worked through your chemo. Like, how, I mean, did you have strength to even stand to do, to operate of all things?
The first regimen, Taxol, was not too bad. I just felt tired the next day, and so I needed to work. I could not work because I still needed to feed myself and my family, pay mortgage and all that, which is the hard part with cancer. You wish that you just could stop everything and just take care of yourself. But like you still had family that you had to take care of, children. For me, I still had to work because I had patients that I had already scheduled for the OR and things like that. But no, Taxol was very easy for me to handle. The only real adverse effect was the hair loss. But then when I went to the Red Devil, which is the other regimen, that was tough. I did you have to do the Red Devil too?
Yes.
Yeah. I still can't drink water to this day because of it, and I can't drink anything with ice because it reminds me of it. I'm gagging now even thinking about it because it just made me so sick and made me into someone that I didn't even recognize. I just
Mm.
went home after each session, slept nonstop, and wish I was dead because it was just so uncomfortable when I was on that regimen.
What were you feeling physically?
It was a level of I think when you have the flu, people say it feels like you got hit by a truck. With the Red Devil, it felt like I got hit by a truck. It backed up, it went over me again, and it backed up and then went over me again. It just was a level of pain that you just can't explain. Every part of you, every bone in you just hurt.
Yeah.
And on top of that, you can't eat. So
Fun.
it was not a good regimen. Yeah,
Yeah.
but was it necessary? I guess so. My oncologist told me I had to do it, so I did it.
You're a physician and you know about the side effects of medication. It's very, very strong. And I remember the nurse came into the infusion room and she was covered head to toe with this big syringes with this red chemical.
Yes.
And I'm looking at her going, okay, you're covered head to toe with the mask and everything. You're gonna put that in my body.
Yes.
And I had
Yes.
a anxiety attack literally.
Yeah. Yeah. Or
So
like,
mm,
how they tell you every time you flush, you have to make sure you're using your own toilet because it will get excreted in your urine and then it will evaporate and affect other people in your family and things like that. But yeah, I'm right there with
y-
you.
yeah, this is radical, but some people choose not to because all these things that you're
Yeah.
poisoning my body and killing me.
Yeah.
What do you
Yeah.
think about that? Like, I know it's a controversial issue, but
Yeah. Everyone is entitled to their own choice. And it's unfortunate that misinformation presents itself in the way it does. It is my desire and really encouragement that people will actually trust the people who are studying the treatments for this in the appropriate scientific manner versus the holistic or the homeopathic things that is just conjecture. Like everything that we do in the cancer realm is because there's data behind it versus mushrooms or whatnot. It can cure your cancer. There's no scientific proof for it. I really feel for those who have so much distrust with scientific medicine that they would do this and then unfortunately they get to a point where they can't come back because the cancer is too far progressed. Do I think that chemo is the only answer? No. So to an extent, I do agree. You need to be working out. You need to be eating the right foods, and that to that extent, I do agree. That's what you need to be doing for your own body, so that you can prepare yourself to receive all those. But I really need to implore those. Please just trust the people who are actually using scientific data to treat you.
it's a tough one because I don't know about you, but when you have cancer and even just speaking personally, people come to you with so many ideas, what you should do and what you shouldn't do. When you're in a position where you're already scared, already
Yeah.
confused, already
Yeah.
conflicted, and all
Yeah.
these people come with so many different ideas, you just don't know what to do, right? It's making matters worse. I mean, I had to say, oh, no more. I mean, because it got to a point where I was getting angry. Can you relate? Did people come to the doctor too with those ideas?
People suggest just odds and ends here, not realizing my profession, things like that. You had mentioned loss of control earlier when we started this talk, and I think that's what a lot of us needs to do. We need to be comfortable with the fact that we do not have control over this, and therefore we need to rely on those who know what they're doing. And so even though my position as physician, like I knew the ins and outs. I mean, obviously I'm not an oncologist or a radiologist or whatnot, so I don't know that regimen, but I just sat back and I was like, okay, I'm here. You tell me what to do, where to go. And that gave me a lot of peace, knowing that there were people who obviously were much better educated than I was in this very cancer. And sure, this is what the data says. That's what you're telling me. Cool. I'm gonna do what you tell me to do. And when you have such a thing, like you said, you're just in such a vulnerable state and you don't know what to think. And just, bridging off of my faith also, we're not meant to, we're not like, why did God allow this cancer to me? That's a great question. I'm gonna have to ask him when I get to heaven. Why did you allow such a cancer at the age of 38 of all things? But it's fine. God allowed it. So what am I going to do about it? And it's not so much, well, God gave it to you because he knew you could handle it. No, we're not designed to handle these kind of trials. We're designed to lay it all onto him, to relieve ourselves of all the trials in our own lives and to depend fully on him. And so by the same token, I released myself of the burden of having to take care of myself. And I gave it to
Yeah.
God. I gave it to the oncologist who God ordained to treat me, to the radiologist, to my surgeon. I was obviously in my community because God knew that cancer was going to happen to me. And his way of taking care of me wasn't to surround me with doctors and not just medical people, but I had an entire village literally come up and establish themselves around me. I had a very powerful women's group at church that just rallied behind me. I don't know how I could have done it without them. Friends from near and far just reaching out. I had the most random people also just become a very stronghold for me.
That's such a healthy perspective, Crystal. Again, I wish I had you around. Was this your temperament going through the whole cancer treatment? Or did you have moments where you're like, I can't do this anymore? Why me?
So my temperament was I have to be in control. Everything has to be my way. If A happens, then B and C has to follow it. So that was my life before cancer. And
Mm.
then obviously this completely disrupted my very way of thinking, my very way of being. And so pre-cancer, I mean, I'm still a bit type A, but I was very type A. Everything had to be in order, everything had to place, everything had to happen the way that I wanted it to be. And then when God allowed cancer to me and said, "Well, nope, you got to change the way that you think." Now, 2 years out, have so much freedom in the fact that there's nothing that I can do to control things in my life, so I'm just going to go with it.
That's huge. So that's actually a good point. What is one thing would you say is something that you gained post cancer and something you lost?
One thing I gained is my ability to empathize, I guess. Instead of being so hardcore scientific, this is the way it is. It doesn't hurt. You'll get over it. It's, yeah, this hurts. It's very emotional. It impacts you on so many different levels. So that's one thing I gained. And then one thing I lost, I mean, I lost my hard personality, I guess. It's been hard. I don't want to just brush off the fact that it's a hard journey because even though I sit here and I can smile and I can think and say good positive things about it, I spent several weeks, if not months, in a very dark place just because it's a tough diagnosis to come by. And especially because, I mean, it's not just because I was young, but I was without children. I can never have children now because of the medications I'm on. And there's just, different realities with me versus with you. So certainly having this diagnosis wasn't without its hardships.
So your mom was your primary caretaker. How had your relationship with your mom evolved or changed, or has it?
It hasn't changed. If anything, she's even more stronger than I know her to be. I lost my dad 10 years ago now this year to stomach cancer, and she was his primary caretaker too. And so when it came time for her to take care of me too, that was one thing that I was very upset about. I asked God, how could you do this to her? Was it not enough that you made my mom go through that with my dad, that you would have to make her go through that with me too? She was a rock star with it. I mean, I think part of it is she just knew her role in all of this and she just did it. And yeah, so again, I don't know what her inner workings were also. You interview her separately. I'm sure she says something completely different. Yeah, she was just a rock star, very strong for me. I don't think we could survive it if it was just black and white. You would be too different or things would be too disarrayed.
Mm,
But it's just slowly one thing changes and then that one change then leads to another one while you still continue on in another aspect, for
mm,
example.
yeah, yeah. That sounds more accurate. I'm free of a lot of things. I since the treatment, diagnosis treatment. Some stuff that was important to me before is really not important to me anymore. And
Yeah.
it sure does bring some changes in one's life. This is such a big event. Emotionally, I was very scared, like super scared of death. Like, what is my future going to be? Am I going to die early? Because I felt like, okay, I was stage 3, went through pretty much same treatments. I was allergic to all kinds of medications. I was like, oh my gosh, am I going to live the rest of my life like this? Or am I going to die earlier? What about my kids, my family? I think that was the biggest thing that I was worried about, my children, because they were
Yeah.
younger.
Yeah.
Yeah.
Yeah. Um, I'm still afraid. It's not that I
Yeah.
live without fear. For that reason, I won't allow them to scan me because I would rather not know. Um,
Yeah.
Yeah, so there is that still in the back of my mind,
Mm,
concern that, shoot, one day this cancer could come
mm,
back. But it's not, again, it goes back to the initial diagnosis. You find it, okay, let's do something about it. And if there isn't anything to do about it, then okay, let's see where we go from here. So I think in all, I'm not allowing it to take control of my life. It's just something that happened in the midst of my life, and I'm moving on now.
yeah. Yeah. Moving on. That's right. Yeah. It's been 10 years for me. And yes, I am moving on. I was grappled by that fear of death for a few years in the beginning. Like literally,
Mhm,
I
mhm.
could not, if I'm thinking about, oh, what should I do next year? Immediately, what if I'm not around next year? That thought kept on coming back to me for a few years. And
Yeah,
it took a while to get rid of it.
yeah.
Yeah.
I think the reality is though, for me at least, it's not just cancer that can take you out.
That's right.
Car accident,
That's right.
freak accident, or something like that. So I think truly with this experience, what I've come to the conclusion for myself is live each day being thankful for the day that has been given to you.
Yeah.
The next day, if you do get to live another day, you ask God for his mercies anew, and you live another day. I hate the phrase YOLO, you only live once, but kind of akin to that. It's just
Yeah.
fulfill your day saying positive things to people around you, loving the people around you,
Mm,
so that when you do go to sleep that night, you can say, okay, I had a very fulfilling day,
mhm.
and then move on to the next.
'Cause tomorrow is not really promised to
Yeah,
anyone, not just
yeah,
cancer patients.
yeah.
What was the most annoying thing that you heard from other people that about your diagnosis?
That's such a great question. And I remember being so annoyed, and I can't remember the question now. What was the most annoying thing that people told you?
Like, you'll be okay." Yeah, like, not in a way, "This is gonna be hard, you'll be
Mhm,
okay." It's just like
mhm.
it's so common these days. Like, you'll be okay. It's nothing.
You know, I think that's along the lines of where I got super annoyed, where people are
Yeah?
like, "Oh, yeah, my cousin had it. She did very well from it." Or like,
Right?
"Yes, yes." And then, I still get annoyed to this day where ladies come up to me like, "Oh, yeah, I had a little mass here that got removed." I was like, "Okay, cool. I don't know how you think your experience is comparable to mine, but sure."
Oh my gosh, yes.
But, I make joke of it, and I think people are saying it from a good place, but if I were to encourage anyone, if you do encounter someone that has cancer, please
Mm,
let it not be, "You'll do fine." Just, "I'm here for you. Whenever you need it, you just let me know."
yeah.
Don't act like you understand what people are going through.
What felt most genuine for you from coming from other people? Praying for you? Like, I really
No,
didn't like it.
I didn't like that either.
Yeah. Like, I'm like, "Are you really?"
I didn't like it when people said, "You look so good,"
Mm,
because in reality, I was dying
mm,
inside.
mhm.
I didn't like it when people said, "You're handling this very well," because the reality is I just put on a smile so I wouldn't have to explain to you just how much I was hurting.
Yeah,
I think the most encouraging thing was just people say, "Hey, I'm here if you need me," and they
yeah.
left me alone. Just knowing that you had people, I think was encouraging.
Yeah, that's so true. Some people told me afterwards that, "Oh, I didn't call you because I didn't know what to say."
That was
Okay.
annoying.
I understand what they're saying. I mean,
Yeah,
they feel very awkward, especially Korean people. Like, what do you say? I understand.
yeah.
You couldn't just let me know that you're thinking of me. That was
Living
a
life.
rough, rough, rough patch. Even after 10 years, I still remember.
At this point in my life, I'm only 2 years out from my diagnosis, and it just seems like one thing after the other, but I'm so thankful that it's not the bad that I remember, it's
Mm,
just the good, and it's just like a small blurb in my life. It's not gonna define me, and I'm so thankful for the strength and the ability to move on from it.
yeah. Amen to that. Yes, I am thankful too. For you and for me and for
Okay.
others. So, what is your next plans? What are you looking forward to?
Travel. I'm looking to traveling and doing things, expanding myself, but just live for the moment. If I wanna do something, I'm gonna do it. If I wanna buy something, I'm gonna buy it. If I'm gonna eat something, I'm gonna eat it. So
That's
that's
right.
just where I am right now.
Yeah, me too. Me too.
Yeah.
You know what? I'm kind of relieved the fact that you say you are sometimes afraid of death. Because sometimes I feel like, oh my gosh, am I the only person who feel this way? What would be one thing that you want to say to women who are going through the treatment or was just diagnosed?
I have to tell you a story. I was, because Nellie from our church too was shortly
Mm-hmm.
diagnosed with cancer after I was, and I was walking with her older daughter to the car, and her older daughter must have been in fifth grade at that time. She turns to me and she goes, "Miss Crystal, I know my mom's going to do well because you did so well too." And then I, like, had to turn my head to keep her from seeing me cry because in that moment, I didn't realize how important it was that I had survived what I did. There are other people around me who will go through it at some point, and they will have family members or whatnot. To hear her daughter say that to me, that she knows that her mom's going to do well because she saw me survive this, was just so reminding to me of the fact that, yeah, we have to fight for each other and encourage one
Mm,
another on through this because other people have to see that this is a very survivable disease. It doesn't take a whole lot to encourage someone. Just something as easy as, "Hey, I was thinking of you," or "I'm praying for you," or "Hey, I got you this small little cookie so you can enjoy it," or something like that. It's just all of the above will be so uplifting. I guess my message is it's a hard pill to swallow when you get the initial diagnosis. Despite all the positive things that we've mentioned throughout the video, don't think that it's wrong of you if you have those dark moments because, yeah, those dark moments are very real. Don't also repress those dark moments. I think definitely you and I are on the other side of it because we were able to work through it. And I think that's the biggest thing. You have to work through all those dark moments and those demons so that you can see the other side. Don't do it alone. Always ask for help.
My last official question, Crystal, is if you were to describe yourself as in food, movie, song, what would it be and why?
Ooh, my song is Flowers by Miley Cyrus.
Yeah.
It's such an empowering song. Hey, I got this. I
Ah,
can tackle things. And again, it's empowering because I can say it from the vantage point of having such a strong community around me. I don't
mhm.
think I would be that empowered if I didn't have people to support me. So that's the biggest thing. People look at me and they say, "Oh, wow, I can't believe you did it. You got through it." I didn't. It's because I had so many people just rallying behind me that I could do it. So yeah.
That's a good feeling. We're not alone, and it's a tough one. It's a tough one, but
And I think
we could do it. Hey, if you haven't subscribed to Take 1.5 podcast on YouTube, please subscribe and follow us on Spotify, Apple, comment, leave, like, and share the links. Thank you so much.